This is Contra Costa Regional Medical Center. We're a 166-bed general medicine hospital, and we're located in the San Francisco Bay Area in Northern California. I hear a lot of stories about visitation and conflicts around visiting hours. That's a very common complaint. I heard about a young child who was raised by their grandparents, and the grandfather ended up in the ICU. And because of our visitation policy, they were not able to be together when he passed away, and it really hit home. It was at that moment that we kind of decided no more, that we could do better.
Hello, Mr. Zarate.
Our patients want their families at the bedside. They want their loved ones to be beside them, especially at a time when they're in the hospital.
This is my little brother, Jack. He's 53, and this is his second bout being in ICU here.
So we'll put this right here. Okay, thank you very much.
You're welcome.
There should be no boundaries for family and friends. Everyone works different shifts. They live in different locations. Some people are traveling 200 to 300 miles to get to their family, staying in hotels overnight because they can't be in to see them. I'm not a visitor. I'm his sister.
People were coming to visit our facility. And so we just turned that upside down. And we said, no one is coming to visit our facility. There's no such thing as a visitor. Actually, these are people's lives. And the people who come to be with them are part of their life. Visitor no more. At Contra Costa Regional Medical Center, we will welcome people 24 hours a day, 7 days a week.
He's doing a little better. This morning when I came in, it was one of those critical points.
Your part has been really important in helping keep him calm and also helping him stay oriented and remembering who he is outside of these hospital walls. Our family partners are just one of the most important things in caring for everyone.
There was a significant quality of care issue that we were impacting by not engaging families in the care of their loved ones. They provide a lot of history. They're able to communicate for patients. When the patient's in distress, they're able to provide a better story than the patient can. And they often will let the admitting doctor know about details that they would not otherwise have been aware of.
We had our policy that was called the visitation policy. We now call it welcoming policy. So it started with the name change.
What we did to implement it is it began by bringing everyone together, all of the key stakeholders. That would be patients, loved ones, different community groups. Our security played a huge role in it, clinical staff of all kinds, and other support staff. And so we brought those people together and said, if we were to go to an unlocked, welcoming environment all the time, 24/7, let's identify all the things that are preventing us from doing that, and then sort of start to problem solve one by one.
The nursing staff are a part of this partnership with security. As chief of security, making the welcoming policy available throughout the evening brought about some concerns. We were worried about safety, of course. My expectations of my staff are that they're friendly and they're approachable and they're helpful, but they're also well-trained and ready for to respond to an emergency. And my staff was fine with the change, and I think they adapted very well. Part of that process was a partnership with the Chief Nursing Officer, Jaspreet, as well as the Facilities Manager, Dave DeWitt.
There were a lot of good concerns that were brought to our attention, good legitimate questions regarding safety, regarding number of people coming, how do we handle, there were a lot of questions regarding HIPAA.
And together we walked the facility, we considered the possible risks and challenges, and we came up with a plan.
We had our managers look at our process and the policy, share that with their staff members before we even did the test to get the feedback.
I think one of the key things was in badging the family members and the loved ones as they come in and identifying the area that they're supposed to be in. If they wander off in an inappropriate area, it can be addressed. And one of the things that was key is that the nursing staff are a part of this partnership with security.
We rolled it out really slowly. We started on 5 units. First morning, senior leadership came in and we sat down with the frontline staff and we went over kind of what happened last night. And they said, 14 people stayed and this is exactly what happened. We reviewed comments from the frontline staff. We reviewed comments from patients and reviewed comments from security and from family members, and then we made revisions.
These are very unfriendly, you know, a stop sign. These are just some of the examples of signage that are no longer in the facility.
We needed to change signs into multiple languages, and so we learned as we go.
One of the things that we did to enhance safety is we placed radios at all the nursing stations that are affected by the welcoming policy, and then we provided training to all those nurses. So if there's an event or a need to have security at their location, they can get on the radio and summon my personnel.
We're going to do an update on the welcoming policy.
It's really exciting to look at this data. I have the welcoming log, and they've been tracking the number of people coming in. And one of the things that I really love about this is that we had the highest number of people during the month of December. Yes. And I know that was so important for families that, you know, during the holidays they were able to come during the evening, the nights, and be able to spend time with their family.
So far, we've had 2,553 visits since September 17th, and they continue to look at ways to improve what they can do while we have our family and their loved ones come to see our patients on the unit.
Sometimes when the ranger gets back, there's additional people waiting in the lobby, and to speed up that check-in process, we came up with a form so that as people wait, they can fill out a small card with their info, and then the ranger, rather than logging them in, can just go ahead and escort them up and then later catch the log up. So we found that that's sped up the process a little bit.
I mean, we were fortunate to live about 5 minutes from the hospital, but we would stay until our son was asleep. He was between 4 and 8 months old when we were there, so he was a little guy, and we didn't want to just leave him. So it was really important for us to get to be there.
Looking at some of the comments, and it just over and over again, it just says how the patient was relaxed, it was positive experience, not disruptive from the staff perspective. But then also just the comments from the family members, you know, one family said they just cried with thanks.
The staff feel very empowered to make the decisions based on the patient's need and the family's need, and they're not bound by some restrictions, rules, and regulations that were before in place.
I live 95 miles away, and I'm here every day, and it gives me an opportunity. When I get here, they allow me to come in whenever I walk in, and I get to spend as much time as I can.
I feel gratified that we've taken an important step in advancing patient and family-centered care. I feel like we still have a lot to do. It's respectful towards the staff and the patients and the community that we serve. I feel pleased that we've taken this step, but there's much more ahead.